Now, the Prime Minister says Britain's National Health Service has been broken by the Conservatives' 14 years in power.
A review due to be published this week will highlight how children are being let down by falling vaccination rates and increasing ADHD diagnosis.
But is Labour just laying the groundwork to blame the opposition for all of the failings for the NHS? Is it time the Health Secretary Wes Streeting steps up and takes some responsibility?
Well, now joining us is the former Chief of Staff to Nadhim Zahawi, James Price. So, James, do you think that the Labour Party actually stand a better chance of reforming the NHS given that they don't have the political baggage that the Conservatives did?
Yeah, good morning, guys. Thanks for having me on to talk about this. It's obviously very important. Everybody watching this will have had some kind of interaction with the National Health Service. And the chances are, unfortunately, it probably won't have been a very good one very often. It's a service that's been struggling a lot. And I know that's heresy for me to even say that on live national television. But, for every wonderful interaction that we may have with it, everybody else will know of somebody or will experience themselves something bad. Now, that is not because the doctors and nurses or even the administrators, certainly not the cleaners, not because they're not wonderful people. Some of them will be not so wonderful, but by and large, wonderful people working hard, doing important work that is, by the way, done obviously in every other country on earth as well. The problem is at the root cause, the system itself. The system doesn't work very well, and just throwing more and more and more money into it is not going to fix it. Labour have found that out, the Conservatives have found that out. But as you say, Labour maybe doesn't have so much political baggage purely because they've just spent the last 14 years saying the Tories are trying to privatise it or something like that. Actually, they've been saying that since it founded. They've been saying that ever since the NHS came along. But if they've been trying to privatise it, they've not done a very good job of it. And these are the same people who try and look to Europe, they try and look to the rest of the continent to say, well, why don't we do it better there? The Germans do everything better, the French do this better, and yet they never do that when it comes to the healthcare service. And yet continental healthcare services and plenty of other advanced healthcare services around the world don't have the same massive problems that we do. Why is that? It's the system.
OK, fair enough. But they're right then, aren't they, to blame the Conservatives for this? Because, as you say, the Tories have thrown loads of money into it, hasn't worked. We can look elsewhere at systems that work better. And the Tories had 14 years to at least put something in place, and they didn't.
Yeah, I think the Conservatives should take some blame for not being able to make these kind of big reforms. Of course, it takes a lot of political will to do this. Really, it's a sacred cow that we can't touch. I think it was one of Margaret Thatcher's chancellors, Nigel Lawson, who said that the NHS was the closest thing we now have to a national religion. But of course, under the long era of Blair and Brown, they didn't fix it either. And yet they saw the same kinds of horrible things. Everybody remember mid-staffs and the kind of horrors that you were seeing there. Patients forced to drink the water out of flower vases because the service quality was so low there. I think this is a problem that has been plaguing Britain because of the inability or unwillingness of both parties to do anything about it. It should be said that Wes Streeting, the health secretary you mentioned at the top of this, has, in opposition and now maybe a little bit in government, made some positive, encouraging noises about the scale of reform that's needed. But since Labour seem to be more focused on doing tiny damaging reforms to our constitution or to taking pensioners' winter fuel allowance away, I'm not exactly sure they're going to have the stomach for this kind of big fight. It used to be said that only Nixon could go to China and only Labour now can go and do this with the NHS. I don't think they've got the bottle for it because those kind of reforms that are needed are going to kick up an almighty stink. And I think that Labour have already found their fingers burned by trying to do much smaller reforms than this. So I fear that it's just going to get worse before it gets any better.
But James, the Conservatives have just been throwing more and more money into the black hole. But actually all along, throughout all of those years and successive governments, it has been the Labour Party who have been egging that on by saying that the problem is that the NHS needs more money. So they've been putting more and more money into an inefficient system rather than reforming it. But what do you think should be done with the NHS? Do you think that the Labour Party have the right ideas when it comes to reforming the system?
Probably not is the short answer on it. You're right. Again, chasing the money is the problem. I think the first thing, we have to all be much more comfortable and confident in saying that there are many flaws in this system and that is not to attack and denigrate nurses and all the rest of it. I think that's the first thing. The second thing I think has to be this, as you say, this kind of endless black hole. If you look at the increase in NHS funding, if nothing happens, it will just take up a greater and greater and greater proportion of the amount of money that government spends every year, until we end up, if Russia is a gas field with a country attached to it, that will just be a healthcare service with a country attached to it. And that's a problem. If you go and look at what you have on the continent, you have a lot of people, they don't have to pay for healthcare in the way that maybe, we think about America having to do this. You can't get treatment unless you've got the money. But they do have an insurance-based system that says that you buy your health insurance, and if you can't, then the state will do it for you. And that inclusion of more private provision leads to better outcomes. We know that the profit mechanism works in all other aspects of life. Why wouldn't it do it here? And now a few people will hear me say then go, oh, you want to privatize it and sell it off and all this kind of stuff. Well, no, I think the American system is probably the only healthcare system in the developed world that's more dysfunctional than ours. But I don't think anybody can seriously look at the system we've got now. It's the number one user of pagers still in the world, the number one user of fax machines in the world. And we have the worse avoidable health death outcomes than the Czech Republic. And I think worse cancer survival rates than Slovakia. Now, they're lovely places, but we should be aiming a little bit higher than that. So I think that the kind of radical reforms to bring in more competition and to bring in more productivity as well, rather than just throwing money at it. Because at the end of the day, if we do that, we'll see more people survive and get better health outcomes, which is what we all want. Yeah,
well, yeah, it's slightly problematic though, isn't it, when you say, anything with a profit margin performs better. I mean, you can see the economic sense for that, and private business will play things more strategically. The problem you've got is we're in a situation now where the rail network's going to be nationalised, and lots of people agree with that because it's falling apart. There's lots of calls now for water to be nationalised because the system is falling apart. So there's got to be a reluctance to say, well, let's start privatising the NHS, because actually the track record of privatisation in this country at the moment isn't looking that great.
I think I would disagree with that. I mean, first of all, I don't think we need to worry about this happening anytime soon, and I don't think a full-scale privatization is quite what I'm calling for. Again, look at the continental models where people they have health insurance that's paid for by the state if they can't provide it themselves. But on other kind of privatizations, the country was in such a complete and utter mess before the Thatcher revolution came along, and people at home will remember, and maybe some of them are lucky enough not to remember, just how awful it was. 3-day working weeks and bodies going unburied and litter not being picked up and roving power cuts and things like that. And a huge part of that was due to the inefficiency of the state-run services. And the wave of privatizations is still having to do work to catch up on modernization that should have been done a long time beforehand. And you talk about trains. Well, actually, the worst bit is Network Rail. That's actually most of what happens. And that's been nationalized anyway. Whatever system we need, there needs to be a big push to increase the productivity. You can't just keep throwing more money at it, as we've said, making things more productive and a better service. Now, I tend to find that if you could make people get some money for themselves by doing that, that's a better spur, a better incentive for them to go and improve these kinds of services, because that's, to me, the best way to actually affect that change. If everybody was to do it anyway, we wouldn't be having this problem, and then it just would be wonderful, the trains would be wonderful, but they're not. And as it stands, I think the last thing I'd say on it is that government is now so enormous. It's trying to do so many things. I mean, for goodness sake, in the last week, the Prime Minister is talking about Oasis, the band, and the ticket resales, rather than dealing with big fundamental problems like the NHS. If the government tried to do a lot less, it could focus on doing the things that it does do, and healthcare, I think, should be one of those things, a lot better.
Smaller government. There you go. James Price, thanks very much indeed. Well, if that's not a Tory mantra, I don't know what is. David's been in touch, says the NHS needs complete reform, needs to go back to its original idea of basic medical care. Everything else should be paid for.
What is very clear is that it's not sustainable for it to continue the way it is, because people are having a really, really bad experience of it. And it's almost as if we've got a universal lack of healthcare.
But what is also very clear, and actually from that conversation particularly, is that how difficult it is going to be to actually change something that large.
Well, and that is what happens, isn't it, when you let an institution become such a complex behemoth, and there's such incentive those in the institution to keep it running the way that it is. It does become increasingly difficult to unpick it, and people have been calling for reform for such a long time. and it's just been swept under the carpet because, you know, it's now got to a point where we have to do something about it. But for so long, it really was such a sacred cow that we just simply couldn't touch it.
We're going to have to break a lot of eggs, I think, one way or another, hopefully.
Not make an omelette.
Well, not make an omelette, no.